generously funded by the Calgary Foundation and Community Foundations of Canada. So yeah, like I'll just give a little bit of an overview of what our organization is all about and what we do, and then I'll let Carly talk a little bit about policy-wise as well. So we've partnered together in this whole sort of process. The Immigrant Education Society is a settlement agency in Calgary, Alberta. We provide settlement programming such as LINK, other settlement services, as well as employment training and other programming. Yeah, language training, it's from literacy level to the CLB4. Employment training, we're an NGO. We have about 1,400 clients coming to us daily. We also have individual programming that's funded by all levels of government, so federally, provincially, municipally, and also other private foundations such as the Community Foundations of Canada and the Calgary Foundation also fund individual sort of short-term programs for us as well. Yeah, I'll turn it over to Carly to talk a little bit about policy-wise.
Thank you, Cesar. Yeah, so Robert and I work with an organization, a nonprofit called Policy-Wise for Children and Families. We're located in Alberta. We have offices in Edmonton and Calgary, and we actually work to support nonprofits and other sectors of government in connecting evidence to people and practice. We really work to meet organizations where they're at with helping support their ability to use evidence that inform wise decisions. And we really support in organizations working in the areas of children, youth, and families, and to really support well-being and resilience in those areas in our communities, particularly across Alberta. We've been around since about 2003 and have been working in that space. Thank you, Cesar.
Just so you guys know, what we'll do is we'll go through our presentation first, and then we'll open the floor to questions. And I think how we'll do it is you can just put some questions in the chat, and then we'll try to address them as they come towards the end. So in the meantime, yeah, so we'll just move forward with our presentation. It's formatted in this way. So this is the outline. So I'll talk a little bit about the state of data management at TIES, and then what precipitated this recent round of activities with regard to rendering in a more remote and digital format our intake process, and Carly will talk a little bit about what they did with assessing the data readiness and what data means to TIES, and then a little bit about the intake form and its consolidation. We'll show you that, and then Robert will talk a little bit about the pilot that we ran in December and January, and after that, I'll talk a little bit about where we're going from here. So yeah, data management at TIES. So as some of you might know, or if you're familiar with settlement agencies in Canada, we are program-wise, it's actually quite diverse. So in addition to programs like LINK, like Literacy and Basic English, there's a whole suite of other different services and programs that we offer to help newcomers adjust and settle to their new environments here in Canada, here in Calgary. So data collection is really driven at the program level and is really sort of driven by the funders and their and funder requirements. So you can see the graphic on the right. It represents really the 4 different pillars that TIES has in its programming. So we have language programming, employment programs and services, settlement programs and services, and then my department, the research and program development department. Each of these boxes represents a different program. And each of these boxes collects data for their own purposes and for their own reporting and things like that. And very rarely is it consolidated in a very intricate and in a very comprehensive form. Perhaps the only opportunity for complete consolidation is during our annual general meeting, and that's consolidated in terms of numbers of individuals served and very sort of high level, not very sort of detailed. There's not very detailed analysis at that level, and we'd like it to move into that direction. Since we're collecting data anyway, it'd be good to go through a process of consolidating it and being able to use it for different analytical purposes. So we engaged in this effort pre-COVID with the light, with the aim to look at it, to get a better understanding of what collectively our clients are looking for, what their needs are, how they move through the program. So if they go from link to employment programs, or if they go from settlement to link, being able to sort of track that a little bit. So it started pre-COVID, but then it was but then it was sort of precipitated by COVID, and the loss of that daily interaction with clients, that sort of opportunity to get daily feedback and have sort of input at reception. We've and with teachers and with coordinators. We've kind of lost that. The environment has always been like, has turned into, situations where we're on Zoom or it's limited by, video access, digital access. So that sort of low level kind of in between classes interaction has been lost. So the process was precipitated by by COVID. We did do a couple of studies. So we did survey in late spring of 2020 our clients and our staff. So we surveyed 124 student participants, and we just looked at what some of the difficulties they were facing in shifting to remote program delivery. As you can see, obviously technology was an important thing, but a lot of that sort of interaction and communication that you normally have in real life, face-to-face situations was also sorely missed. So they missed their classmates, and they missed communicating with staff, for example. So on the right there, you see the different pillars and the different sort of factors that hinder programming. So again, technology is obviously there. So especially early on in the pandemic, technology was a great obstacle. But again, communicating with staff, missing classmates was also an important part of their important segment of their concerns that came out of the survey. So with regard to staff, there were the big challenge, the three big challenges with regard to remote program delivery really centered on the difficulty with connecting with students and clients, and technology always is up there, struggling with the new technology, learning how to use Zoom and Microsoft Teams and stuff like that, and also being able to assess learning. So it was a completely different way. They had to reconceive how to assess the progress of students. And so that sort of really kind of gave renewed impetus to the process that PolicyWise and our department had been engaged in already, and the importance of being able to digitize our data collection and consolidate our data collection became much more pertinent after the pandemic. So I'll turn it over to Carly to talk a little bit about what exactly we did with regard to the process of thinking about managing our data and consolidating our data.
Yeah, thank you so much, Cesar. So as Cesar mentioned, we actually started this work conceptualizing it really pre-COVID and thinking about how is data being used at TIES. At PolicyWise, we've had the privilege of working with a lot of different organizations, and we never hear anybody say data is terrible, we don't want to use data. It's really more, how do I use data well? What do I need to build in terms of my staff capacity to use data? What technology do I need? Am I collecting the right data? And so we've been working over the last couple of years to help understand and unpack what it is to be a data mature organization. And so TIES, was really interested, as Cesar described. They collect a ton of data. I mean, 1,400 clients a day, many, many programs, I think over 20 at any given time. And there's a real sense that there's this rich, robust information, but being able to use it and harness it in a way that can improve programs and services over time has been a little bit lacking because the data isn't brought together. It's used for individual programs. And so we really worked with TIES to understand where their staff were at. We did surveys and interviews with staff back in 20, so I'm getting confused on the years. In 2020, I was post-COVID, so we already had the idea going, but then we said we still need to understand where TIES is at. So we did a survey and got a sense for what the maturity level is. These are just some building blocks of data maturity, and just to give you kind of a sense for what this means, an organization that is at the beginning stages of data maturity, for example, might collect data on clients that's very basic, but it's probably not centralized. It might be on Excel spreadsheets or even sign-up sheets. On the other hand, organizations that are displaying mastery of data, for example, would be using integrated data. They would be collecting minimal but appropriate data, knowing exactly what's needed, being able to reuse that data, link data across programs, be very predictive in their analyses instead of just reacting to a funder request, for example. So all of these building blocks are mapped out in terms of where an organization is with data maturity. Next slide, please, Cesar. So that gives you a sense for what we were looking at overall. We did a number of things to understand where TIES was at. As I mentioned, we did interviews with program coordinators and managers to understand the context of data. We did a survey with more staff, because there are quite a few staff at TIES. So we weren't able to interview everybody, but we wanted to get as much input as we could. We also did a data inventory. So that looked at all of the data that was collected by all 20 of the current TIES programs at the time to understand what were they collecting data on. Was this data on people, attendance, and so on. And that just gave us a sense of just the nature of data at TIES. And then we ran at the end a facilitated workshop to kind of help TIES explore where were they at with data and where did the organization want to go. And so I'll share with you next, in the next slide, what we found was overall the data maturity of TIES, it was really in the learning stages. So beyond beginning, in a number of areas, it was at emerging and learning, but about halfway there, the evidence was suggesting that there was a lot to build on, but there were things that we could be doing to really improve the direction of data at TIES. And so we'll dig deeper into a couple of those. Next, please. Yes. One of the things that we found to be really important is understanding why data is being used. It sort of is the driver of all the things. And especially when we think about changing the way data is being collected or used in an organization, it's really helpful to know what is the purpose of the data that's being collected and where does staff and leadership see value in that. So we actually did work to try to understand where TIES was thinking they could invest their energy for how to use data. There's lots of different ways to use data. You can use it to predict client needs and services, for learning and evaluating about programs, for measuring income, impact and outcomes, and as well as things like funder reports. There's always that. All the way up to things like strategic planning and raising funding and revenue and influencing policymakers. Next slide, please. And in our work with TIES, we found that they were really using data to do funder reporting. I mean, a lot of times it says, you need to report on how many people came, what was their immigration status, how long have they been in the country, so on. So those are the kinds of legal obligations that were being met. As well, TIES did want to do a lot of predictive understanding of who the clients are and what are their needs, and then measuring outcomes and impacts and improving efficiency, services, and resources. So some of the things we heard were that data can be used to indicate trends and settlement patterns for newcomers, and that it would be useful to use that to inform program proposals, but also across departments to indicate which clients could be suited for additional programs. And as Cesar mentioned, when COVID hit, that kind of ability to sort of flag people from those hallway conversations was really lost, because a lot of times that kind of interaction might have been without data. It was still happening because people knew of their students, they knew what they were running up against. There was more talk between staff because everybody was co-located. And as that went away with COVID, having ways to target programming for clients and supports became more difficult. And that's where data can really be supportive. As well, program development helps people have a clear picture of the profile of our clients and can help us think about how to tailor their needs, language, employment, and social supports, and so on. Next slide, please, Cesar. And so what I'm showing here is actually directly from all of the staff at TIES when they got together and said, where do we really want to put our energy? I mean, tackling and overhauling a data system within an organization, especially one as large and complex as TIES and serving as many people as are being served on a daily basis, it doesn't make sense to try to eat the whole elephant at one time, but instead to really prioritize and focus on what do we really want to know in the first iterations of improving our data capacity. And what floated to the top for everybody across the board was predicting client needs and services. And conversely, that really does improve the ability to strategize and plan and improve efficiencies in services. So those other things really came out of that, but everybody said we really care about understanding our clients better. Next slide, Cesar. So again, this is a restatement, but this idea of, so we want to understand our clients better, but as Cesar mentioned, there was 20 programs. We found in the data inventory that the way that data was being collected with the 20 different programs was somewhat different across the board. And so that makes it really difficult to reconcile and standardize and integrate data for all of those programs. So one of the things that was flagged was the need for more standard approaches to client follow-up in particular, but also client intake as a way to facilitate standardization within the organization. Next slide. And so as I mentioned, one of the things that we did was actually to do that data inventory of all the data that were collected. And what emerged from that was that it actually quite a quick win, something that wouldn't necessarily be, it wouldn't be easy, but it wouldn't require a full overhaul of all of the entire, processes and intricacies of how everybody was doing their work, was to think about the intake form. And I'll let Cesar talk a bit more about that. I'll just mention that we, as part of our work with TIES and with other organizations, one of the things we found is that standardization on things like intake forms is really something organizations care about, but struggle with how to do that well. And so we've been co-developing a resource called Build Better Data that has lots of tools to think about that. So we just put that website up there because a lot of the ideas we talk about in this project are living on that website now. So Cesar, if you want to go over why creating an intake form came out as a good next step for us.
Yeah, I think through the process of thinking about how to consolidate the data and how to manage data better in our organization a little bit, we really centered on the initial intake form, the initial sort of contact with the clients. And collecting, their information on that sort of first point of contact. So, oops. At that, up to that point, every individual program had their own individual intake form, and when a client would come to TIES, come to reception, the receptionist would do a little bit of narrowing down as to what types of programs and what programs this individual might be interested in, what their needs are, and then after that, go through a whole folder full of different intake forms, and then they would pull out the appropriate one and they would fill it out, and then contact the coordinator, and the coordinator will come down and make that sort of take the next step in the process. So consolidating the data that's connected at that sort of entry point, we thought would be an important and powerful strategy to get the whole consolidation of data started. As Carly mentioned, we collected a diverse set of the different intake forms and looked at all the areas that were common, and looked at all the areas, all the fields that were common and all the fields that were unique to the programs, and came up with two sort of concepts: Form A and Form B. Form A, in essence, is the universal intake form. Form B are all the program-specific fields that other programs don't use, that maybe that particular program can add later. So the Form A, the universal intake form, becomes this sort of thing that all programs use, so that we can put that data together and get like a picture of TIES as an entire organization collectively, and then and again sort of use that data in different ways for different to sort of drill down different bits of information. So as you can probably imagine, there were a few challenges to doing this. Obviously, the diversity of programs and the diversity of program requirements, and our sort of solution, like I mentioned, was to come up with the concept of Form A and Form B. Diversity of intake processes. Actually, there are many different inputs. Actually, you can also express. There's an expression of interest button or a registration button on the website. So if you're visiting TIES for the first time via the website, you can click there and then put your name down and then say that you're interested in this program. And there's some sort of details that are in there. There's also online chats where you can express interest on different programs, and then the coordinator would take it from there to register you in another program. So there's different sort of processes of intake that really merited a little bit of consolidation. And obviously overall, the source of this entire sort of initiative is that there was no previous culture of data consolidation. So people at TIES really hadn't really conceived of a process or a way of collecting information, collecting data in a standardized way. So this was our first step towards this standardization. This is just like a comprehensive list of things, or not a comprehensive list, but a partial list of the things that would be included in Form A. And in Form B. So in broad terms, Form A is what we, through our survey of all the different intake forms, determined as being universal, all the fields that everybody takes. And then Form B are the things that, the program-specific funder requirements are added to that. What this project worked on was really Form A. Form B has become this sort of future concept, future thing to tackle. So what Carly, me, Robert, and Katerina moved forward with was the development of Form A, putting it together and then testing it in a pilot in December and January that Robert is going to talk about next a little bit, because we put it on a temporary platform called RedCap and tested it with some of the coordinators at TIES. So I'll hand it over to Robert.
Great. Thank you, Cesar and Carly. I'm Robert Yagodzinski, a data analyst at PolicyWise. And so my main role in this particular project, the TIES Treat Intake, was to help move this pilot forward in terms of collecting some data that would allow us to see the effectiveness of this, of the intake form, and run that pilot for about a month and then analyze some of those responses. So we used a RedCap database, and this was extremely helpful. RedCap is I believe it's free, and it's offered up from the Vanderbilt University, but there's a number of universities out there that have a server on there. University of Alberta has been one of the partners of PolicyWise and has given us space to do things on this particular system. And REDCap itself is designed more for longitudinal studies, looking at, say, drug trials and also maternal infant cohort studies. But we're seeing more and more that universities are offering nonprofits to come in and be able to use it for various purposes. So this is extremely helpful, because not only is this a free service, but it allows us to go in and control and edit, test things, and see what works and what doesn't. And so we can learn and improve those forms before we actually go off to a large software company and spend a lot of money to turn this into a final product that will be utilized by everybody on staff. So that's one real awesome thing about REDCap. It is kind of a limited database system, and it's not completely relational, but it does allow you to look at some of that longitudinal information and just get some very basic things and enforce formats, etc. So that gave us a lot of control over what we were doing. The pilot ran for approximately just under 2 months. And in that time, we collected 90 responses during that period. And so we were able to analyze that and get some interesting findings from that. During that time, there were only 2 program areas which clients had identified they needed help with. So language and employment. And of course, Cesar talked about the 3rd pillar, settlement. And I guess at this time with the state of the world with COVID and everything, settlement may be less of a need. But of course, now we've developed this capability there. So when those clients start coming in, we're able to accommodate them as well. Next slide, please. So looking at some of that data here, we were able to get some very general demographics about what was going on. So 71% of clients identified as female, and that was roughly the same between each pillar, employment and language. So maybe give or take 2% on the other side, so 68% versus 72. And so that was pretty consistent across programs. And as you can see in the ages here, more people tended to be in that to mid to late 30s age. There was a slightly lower age for clients in the employment program, whereas language clients tended to be somewhat older, closer to 40. So that was another interesting finding there, just given where some of these people might be in their journey as well. Next slide, please. So in terms of reaching out to clients and then sort of getting that message about who TIES is and bringing them in and being able to send the awareness and get the message out, have new clients come in and be able to participate. Most of the clients were actually brand new during this pilot testing period. There were only 12 clients which actually were identified as being a current client of TIES. And amongst those returning clients, there was roughly the same in the English program, like in the language program, and 40% identified being in the employment program. So interesting that some clients are returning to language program and some are moving to the employment program. How people heard about TIES, it's still very much through community services and just hearing about it through various agencies. Calgary Public Library was identified as a big one. A number of other community serving agencies would refer people to TIES. Personal contact is another big thing, that the word of mouth, friends, family, acquaintances, that's a huge one. 37% of clients. And also interesting that in this day and age of social networking and internet and everything, 8%, only 7 clients actually heard about TIES through Facebook or Google searches. Next slide, please. So this slide somewhat corroborates that finding of the community service as being a primary way of referring clients. Now that blue doesn't appear so strong in this slide, but if you look up that northeast section of Calgary is where the 3 TIES offices are located. So there is that community connection, that interaction amongst agencies within that sector of Calgary. And so that again reflects where clients are coming from, especially via community connections and perhaps some of the immigrant population, they're learning word of mouth about ties and where they're coming from. So you do see some other clients distributed throughout the Calgary area, and even one or two that were living out in some of the more bedroom communities, the acreage areas that are close to Calgary as well. Next slide, please. And just splitting things up by program area now. So if you look at the language programs versus the employment programs, the employment program, that bar chart on the top there basically shows that 64% of employment clients have actually done some education beyond high school. And then this reflects to 28% of language clients who have done some education beyond high school. And also, a number of those language clients have not even achieved high school yet. So it does reflect some of those needs there. And it was interesting seeing Cesar's slides at the beginning there, seeing technology as a barrier, more so for clients in the language program. So this does seem to reflect some of those trends. And of course, as we move to remotification, technology barriers are one of those things that seem to be fairly ubiquitous and whatnot. And so actually having skills and having access to the technology is probably one of the big things that we might learn from this. But you do see then that there is also a logical path here. Clients will go into the language programs, and then from there, they will proceed to the employment program. Sometimes that's a prerequisite, but as they develop those skills and confidence, you might also see that reflected in some of the education that they are completing and attaining along the way. Next slide, please. And then this is another interesting slide in terms of just looking at the range of needs of clients. So the top slide or top graph there talks about the employment program clients, what they specified they needed help with in the intake form. And this, of course, just reiterates what was going on in terms of a choice of program pillar, that you would have 74% of clients that would want to find a job amongst the employment program, and 100% of language clients wanted to learn English. And amongst employment clients, sometimes this is a government requirement, and maybe they want to learn about Canada. But when you look at the language clients, there is a much more broad range of needs there, and potential opportunities for ties to help out with. So again, learning English 100%, but other things, employment is a need amongst them. Sometimes they want to learn more about Canada. And there was also an additional question. You'll see in the bottom right corner, there's that specification, need help with life in Canada. And that triggered an additional question. And if you move to the next slide, please, Cesar. This is the results of that question in the language program. And there were only clients in the language program that actually answered. When they specified that box, need help with life in Canada, then it triggers this additional thing. What do you need help with? And this was a multiple choice thing. So people could select as much as they want from these options. And as you see, there's a broad range of needs here. And again, this points to some of what Cesar was talking about with ties and the various additional services that they might offer. So childcare is a big one, because clients might need a place to put their children during classes, etc. But other things, health, housing, finance. And this only speaks to those additional services that Cesar was talking about at the beginning. And one thing we identified with the pilot, this question was kind of tucked away, and we've now put it as one of the very first questions to ask clients, so we can get at some of those additional needs there.
Thanks, Robert. So Robert just sort of demonstrated how, through the pilot, we realized how, or at least we sort of actualized how powerful being able to consolidate and being able to do a little bit of analysis on the data that we already collect. So this is a process that already exists, doing intake, and what we did was we just consolidated that process a little bit, and now we have this data that sort of aligns with each other, and with a little bit of analysis, there's some really valuable and really sort of interesting insight that we maybe never would have been able to find had we maintained the siloed process that we had previously. So So again, like this is sort of like just a little bit of a representation of, again, our aim that, you know, all ties data on intake and client contact would be consolidated into this one database that's sort of manipulable, that's analyzable, and you know, and one of the possibilities is being able to sort of identify sort of areas of opportunity for us to develop more programming, areas of strength, you know, where we're, you know, doing exactly the right thing, and where there are sort of like gaps, you know, places that we haven't addressed yet, things that we hadn't foreseen, things that we haven't perceived in our sort of previous way of operating. One of the things that we would like to do in the future as well is to conduct these sort of periodic analyses, like what Robert just showed, that came out of our pilot, maybe a quarterly reporting on TIE's client data and some of those needs, and yeah, and a better understanding, like I just mentioned, about you know, their movement through our programs and what some of those sort of unforeseen requirements and needs are, and where the gaps in our programming is. This is an ongoing project. So this is really what we have after the conclusion of our pilot in January. We're transitioning now to moving the universal intake form into a more permanent environment. At the moment, we've identified the platform called SchoolSense because it has already has an established presence in some of our programs, and really it was just a matter of extending that presence into other programming with this part of it. So in April, we hope to transition a lot of the functionality and a lot of the formatting that we have in REDCap into SchoolSense. April, May, and then between April and June, we hope to transition all the existing programs, or as many of the existing programs at TIES as possible, onto the universal intake form. And then maybe by the end of June, we would have better insight of, you know, again, some of the on some of the data that's been that's been collected with all the programs having bought into the universal intake form, as well as what some of the kinks in the whole process of implementing it might be. And by the summer, hopefully we would be able to start doing some regular analysis and reporting on that sort of consolidated data. So we conceive perhaps like a quarterly demographic report for TIES to be used internally and maybe externally also to inform some of our partners and other stakeholders. So yeah, it's an ongoing process. I think this is sort of just the beginning for us in consolidating and managing our data. Building that sort of permanent intake form, the potential uses of the data for assessment and tracking, and later on really sort of making our operations around data a little bit more robust and more permanent in the form of somebody really kind of taking care of it. So like a type of Robert type person who does the data analysis and can regularly mine the data for whatever we need at that particular time. So that concludes our talk. I guess we can transition over to the question and answer period. Thanks everybody for listening.
So it doesn't look like we have any questions in the chat right now. So if any of the attendees would like to ask any questions to our panelists, feel free to either put the questions in the chat or of course unmute yourself and turn on your video if you're not feeling too shy, and you can interact with our panelists directly.
Does anybody have any questions on any of those sections on the pilot or on our process? So there's a question about accessing the intake form. So at the moment, it's on a pilot platform called RedCap. So there is no external access for it. And when we set it up, it's not a it's an administrative form. So typically, an administrator and or a coordinator or a receptionist would have access to it. So it's not public facing in that sense. The public facing end of our registration process is, or our intake process is an the expression of interest registration button on our website. So it isn't really meant to be public facing. So it's meant to be more of an administrative tool. So, so there's a question now about Form B being a universal form. So Form B is not intended to be a universal form for programs and ties. Form B is just like this sort of like umbrella concept. Form A has been formatted to be universal. So the fields are universal. So name, age, immigration status. These are the things that, you know, all our programs ask. So we've consolidated that on Form A. And then Form B is a concept, a space where other programs can put their more specific needs. So if there's an employment program, they may ask about like employment history or maybe your profession or something like that. Or if there's a settlement program, they may ask other sort of specific things. So that is meant to be program specific. You're welcome. So we have another question from Bridget. Thanks for the presentation. Appreciating the level of detail and collaboration that goes into these digital transitions. Was there any intake info on those who may have had assistance or need assistance in filling out a form versus those who may have been those who it may have been more intuitive for? I can let maybe Robert elaborate on that, but again, the intake form isn't a form that is client-facing necessarily, or isn't built to be a form that's client-facing. So when they provide information at the intake stage, it's facilitated by a staff member. So that barrier isn't necessarily evident, but definitely a technological barrier is there. Maybe, I don't know if Robert has any.
Yeah, I think that the only thing I could comment on that is maybe that additional question around needing help. If you were to go back to that slide, there was one selection around translation services. I mean, it still may be a stretch to put that in there. So, oh yeah, go back to the other slide, forward. Next. Oh, are you going backwards?
I'm going backwards, I'm sorry.
And yeah, so okay, that one year, yes. So translation and interpretation, perhaps that alludes to some of the needs of the clients out there. Again, we were only able to sample 10 clients here. So having this up front in the intake form, that may be able to unpack some of that, but that might be something very specific too that could be addressed, such as do clients need assistance with administrative tasks and some of that, and when you unpack those translation services. So it's a great point.
We did conceive of like a mobile version of the form, and the testing environment for it, RedCap, was really conducive to having it appear on a mobile phone or on an iPad, and we did test it on an iPad as well. So it was actually quite user friendly. But I think because primarily, and this might answer Nadia's question as well with regard to clients themselves filling it out. Really, the operational function of the intake form, or within the whole sort of intake process, it's the staff member or administrator that is the primary person that fills out the intake form. So a client would come and speak to or would contact a coordinator or intake person, and that staff member would sort of speak to them and fill it out themselves. Are there any other questions? Okay, I think we can wrap it up. Thank you, everybody, for coming. Thank you, Robert and Carly, for joining me in the presentation, and thank you so much, Chris, for your help mediating the session.
My pleasure.